And we are back. We're here with Harlan Kleiman from Harlan Kleiman Limited, and this is the first of our 10-part series on Harlan on Health. So welcome, Harlan.
Well, thank you very much.
So I thought, what we should do is we have a 10-part series here, and I think it's going to be an extraordinary series. So why don't we do the setup here and talk about what brought you to health in the first place, because you've been on the show before and we've talked about this extraordinary career you've had in investment firms and television, theater, film, and you made your way into health, and somehow that led to this particular expertise. So why don't we take it how you got here, and then we'll talk about what you plan to do.
Okay. Well, let's start off very quickly. The frustration that I had came in 2004 originally. I'd never been in a hospital before except to visit sick friends. And I was on the board of a major hospital in California. And all of a sudden, I went to my doctor, who told me that I had to have open heart surgery. And this was pretty shocking to me. But I had to go in and do it, and I had to go in and do it quickly. So I went into the hospital, and now I'm a patient for the first time in my life. A staggering experience if you've never had it. First of all, everybody's polite to you, but nobody talks to you. What I found was that people give you information in inverse proportion to their position, their power, and their knowledge in these medical institutions. So I said to myself, if I'm a relatively smart guy and I am fighting for information to find out what's going on here, and I'm on the board of this hospital, what happens to other people? And that's what started it off. That was in 2004. And over the years now, I've started healthcare companies. I'm in the midst of building another healthcare company now. I'm in the midst of building a healthcare fund now. But I said to myself, what do they need to know? Number one, they need to know how health insurance works. And it changes dramatically. And when you're in a senior or you get to that place, it changes even more. And you don't know, when do you use a supplemental? Who uses it? How does the Center for Medicare and Medicaid work? All of that business. How much insurance do you really need at this point? What are the criteria that are involved? How do you deal with prevention? Something that's really important. And by the way, what's preventive health? What's a fad and what's not? What is integrative medicine? These are terms that are being floated now all over the place, and people aren't sure what to do with it or how to deal with it. Supplements. You can spend easily, if you really get diligent and religious about supplements, $100, $150, $250 a month or more on supplements. And what do you get for it? I heard a doctor say lately that it literally creates the most expensive urine in the history of man. There are things, so those are the things I want to talk about. I want to talk about diet. What's a good diet? What's a bad diet? How do you decide what a good diet is? Sex. How do you deal with sex as you get into your 50s, your 60s, your 70s, your 80s? So these are the kind of subjects. And then I want to go into what the Center for Medicare and Medicaid is doing now. What happens if Hillary becomes president as opposed to Trump? How do the Democrats deal with health care as opposed to the Republicans? We have so much to discuss. And what I love to do is empower people, to give people the information they need so that they're smart. The stuff that you painfully go through while you're learning this process.
It's really interesting now. I have this question, and I think your starting point for me is probably the starting point for this entire series, and that is patient advocacy. And the reason it's familiar to me, because as you know, I had a mother who has passed on since, but she was in and out of hospitals for about 3 or 4 years before she passed on. And one of the things that I noticed, and I don't know what to do about this, and I'm hoping you'll share this with the audience, is that if I did not know it, the hospital didn't know what to do. If I didn't know what her medications were at home or her conditions, or what in fact, one doctor was saying to her, one specialist who may be caring for her heart, another specialist who was caring for her kidneys, and they weren't communicating, the big fear is, what happens if you can't do it for yourself? It's one thing to know, write down everything about yourself, but what do you do if you can't do it for yourself?
Well, that's a critically important question. But let's step back for a minute. The average person who's 65 years old has got five different maladies that they have to deal with. Each one of them, they go to a different doctor, or what they euphemistically call specialists. No doctor is looking at what the other doctors are doing. So your mother is sitting in a situation where there's five different charts explaining what's the matter with her. None of them are integrated to the other charts. She could be having drug interaction problems that are killing her while they're supposed to be helping her. And they may be helping her in one area, but not in all the others. Who's integrating all that stuff? Fortunately, this year, so that if you don't have an advocate and you can't handle things for yourself, you're in major trouble. That's right. Now, one of the things that's going on right now is that the Center for Medicare and Medicaid has done a wonderful thing this year. They have passed a ruling where you can request from any of the physicians that you go to. Now, this may not sound like a lot, but it's major. Mm-hmm. You can request your own medical records, your detailed medical records. There are certain institutions that you go to where if you want to leave, they'll give you a précis of your medical records, but not the whole medical record. So that when you go to anybody else, you have to start over. You sit down, you start filling out the forms all over again. You put down all of your maladies all over again. You don't have sitting there all of the medical information that doctor needs. And that medical information isn't integrated with all of the other stuff that you've got. So it is a complete mess. So one of the things that the Center for Medicare and Medicaid, are you getting feedback, David?
I'm getting a lawnmower.
Oh,
it's all right.
It's a wonderful lawnmower, I'm sure. One of the things that one has to do is, first of all, make the request to get your own information. But then once you get that information, what do you do with it? Well, one of the things that I don't want to make this too much self-advocacy, but one of the things we're doing now is setting up a situation where it's totally, everything I'm doing is patient-driven, patient-centric. Right. Whether it's a patient in the hospital, but principally the patient in the hospital is one set of dynamics, but the patient who's out of the hospital, who's at home, who wants to stay at home, who goes to the doctor for all sorts of things where they don't necessarily have to, thereby burdening the entire medical system. But at the same time, they need that information, and there's no easy, dynamic place for them to get it. So what are we saying? We're saying that we need to be able to have that doctor, or they have to get that information. They have to get it into their own repositories so that they can access it easily, or the professionals that they're dealing with that are helping them can access it easily. And you integrate it all into one medical record so that you are a holistic person. You are you, and you have an opportunity for the first time to take control of your own health, no matter what age you are and no matter what level of maladies you've got. And that's what we're working on. That's what has to be done. But it starts with all of the elements that we started talking about earlier in this program. And by the end of it, hopefully, you will be empowered, you'll be armed, you'll have your own, how can I put it? You'll have your own combat guide so that you'll be able to be the most powerful you can possibly be. And then we will have succeeded.
And that's the perfect way to end this first segment, actually. And I think what I'd love to talk about next time, and maybe we can think about this as part of our agenda in the Harlan on Health series, is what role technology is going to play in helping the patient be an advocate for themselves moving down the road. But right now, we're out of time, and next week will be the first, really, in the series of our chats. All right, I thank you, and I'm going to see you next week.
Thank you.